covering news where you live. This is 5 News at 6.
Thanks for joining us for tonight. For your 5 News at 6, I'm Darren. Bob Alexandra is on assignment tonight. This week, the Arkansas Department of Human Services announced more than 427,000 Arkansans have lost Medicare coverage, interrupted, or terminated at some point in the last 6 months. Tonight, 5 News reporter Rachel Williams takes a deeper dive into how the community is responding.
The Democratic Party of Arkansas held a press conference in Little Rock on 6-month Medicaid unwinding. The disenrollment process left more than 427,000 Arkansans without health care, including 147,000 children. Arkansas Democrats are raising concerns about that interruption.
That for so many of these people, it's not just an inconvenience. It can delay or terminate necessary medical procedures.
Arkansas DHS Secretary Christy Putnam says the process ensures that the program now is serving only those who truly need Medicaid. Arkansas Democratic Party Chair Grant Tennell says for most of those people, no determination was made on their eligibility for medical purposes.
We know that somewhere close to 70% of the people who've been terminated were terminated only because they didn't respond to a letter or answer a telephone call.
Governor Sanders' office sent a statement saying, in part, Arkansas is complying with state and federal law to remove Medicaid recipients who are no longer eligible for the program and will continue to do so responsibly. The Marshallese Community in Northwest Arkansas was hit hard by the Medicaid disenrollment. The Office of the Arkansas Coalition of Marshallese says many are confused about their insurance status.
Parents calling our office constantly saying, hey, I got our kids turned off, or why wasn't I meeting the requirements for Medicaid? We have a few or a couple of parents who say, I turned in everything, and they're still saying that, they didn't receive the paperwork.
ACOM Policy Director Michelle Pedro says the group is working with community partners like DHS and UAMS to sort everything out, but the biggest challenge is the language barrier.
I'm translating the materials because we'll have a couple of parents come in or folks come in to our office and say, hey, this isn't Marshallese, but the translation is not, I don't understand it. Because we already know the wording of it in English, it's kind of easier for us to explain to them. Yeah.
Pedro hopes an alternative can be found for those who were disenrolled or don't qualify.
I would like to see something that's really affordable for them. It's kind of hard with high premiums or medications that are really expensive.
In Springdale, covering news where you live, Rachel Williams, 5 News.